Aloha, happy Monday. Thank you to those of you who are already tuning in and joining us for our very special guest. I'm Yanji Denise, joined by Ryan Kalesuji. Of course, this is Spotlight Hawaii. Mahalo for starting off your week with us. And Ryan, we have a guest today that always gets plenty of questions.
Yeah, we got a lot to cover here this morning with Lieutenant Governor Josh Green, who's joining us live from the Hawaii State Capitol. Good morning, Lieutenant Governor. Great to see you once again.
Good morning.
Thanks for starting off the week with us. Let's first start off talking about the vaccine rollout. We know your role in the distribution of the vaccines. If you can give us an update of where we're at right now here on April 12th as we enter in another week.
Here on April 12th, we've delivered in the state 954,594 doses statewide. 730,390 of those doses were by the state program, 124,000 by our Department of Defense, and the balance through the pharmacies. So it's pretty extraordinary. We will touch 1 million doses delivered in our state sometime later this week, about Thursday or Friday. And that sets us up in a very good way as we launch to the whole state. As you're fully aware, today on the 12th, we are now open to age 50 and up on Oahu. Already in the neighbor islands for a week or so, maybe even a little more. They've been widely open because they had fewer people seeking appointments. So we're getting real close. And next Monday, when you're in the middle of your interview with whomever, it will be wide open, so anyone can sign up. Though there are some constraints still, we don't have a flood of vaccine coming into the state. We still have a lot. This week we will get 76,060 doses, down a little bit. We'll talk about that probably. Next week, we will get about 69,000 doses, so 145,000 doses will come in. That's the baseline. We may get some extras. We often do. And we have, I wouldn't say surplus per se. It's just that we are, of course, in the process of vaccinating people in their second dose also. So we're really getting to a ton of people. We're exceeding the calendar expectations I had. I had pegged us to get to 1 million doses by, I think it was May 1st. We're going to instead get there by about April 16th or April 17th. So that accelerates everything. And the more doses we get into people, the faster we'll see drop off of cases and hospitalizations and so on. So overall, good progress. We were ranked 10th by Johns Hopkins and 13th by Johns Hopkins for 2 of the main indicators in the country against the other 50 states and territories. So I'm pretty proud of our team. It's not perfect, but I'm excited now. So anyone who would like to get a vaccine, please do.
You know, so far, the way that they've been opening the vaccines, it's been very controlled, just 5-year increments and, then down from 60 down to 50. But then when you go from basically 16 and up, what are your concerns in terms of any kind of a bottleneck? And how are you advising people that are signing up for this? We don't want people to flood the websites, see that they can't get one, get discouraged, and then just say, you know what, forget it.
Sure. No, that's a very good question. So some people have asked me, why did we go to age 50 today, down from age 60 on Oahu, where most people live, where 1 million of our citizens live? It was meant to stop that problem, at least to a degree, so that we at least have one extra week for everyone age 50 to 59 on Oahu. And then next week it opens totally wide. There will be some bottleneck, but we have given 4.5, 5 months to our kupuna to get vaccinated with lots of support. Again, there's still going to be more people that need help and more support. A lot of people were kind of, vaccine hesitant or waiting, but this increment is pretty good. Director of Health Char wanted to kind of wait until May 1st to spread it out a little bit more over the weeks. However, I was really pushing hard because President Biden asked us all to be open, all states, all 50 states open by the 19th. That was also before the Johnson & Johnson snafu where they lost, 10 or 20 million doses. But I think it's important now that we've seen a lot of available spots on the neighbor islands, spaces on the neighbor islands, that we get people vaccinated. And if you have to go a week or so in line in your appointment, it's okay. I kind of say this, how when a good movie comes out, everyone tries to go on Friday or Saturday and it's a mess. Well, it may be a little bit like that. Because this is a movie people wanted to see, which is a vaccine opportunity for themselves and their loved ones. But if you just are patient and you go to these websites, go to hawaiicovid19.com. Also, if I may, go to the CVS website, the Walgreens website, the Safeway website. Go to these websites, and the pharmacy programs are really getting a lot of vaccine now. You will likely find in your community a spot at one of the pharmacies, and you'll be surprised. No line, just one person at a time. They're very steady. I highly recommend that for people. So all of these different opportunities, the health centers, the pods, one way or another, we will get you vaccinated. And it looks to me like we will now, boy, by May 1st, we probably are going to be closer to 1.2 million. By June 1st, we're going to be closer to 1.6 million doses. We will be all but done mid-June at this rate. It continues to move up calendar-wise. And by July 4th, we will have likely achieved herd immunity, with the exception, of course, of our adolescents who are only now getting approved to start getting the shots.
You know, one of the headlines that's coming out from across the country is the Johnson & Johnson vaccine. And you had made note of it just moments ago. You know, some states reporting that they are going to see as much as an 85% of vaccines that they were expected to receive from Johnson & Johnson, which is impacting their overall rollout in these states. What is the significance that we're seeing? Are we seeing a dramatic decrease in the Johnson & Johnson vaccines coming to the state? And how will that impact things moving forward?
Yes, that we are. So we were expecting 81,000 doses this week, which included the Johnson & Johnson batch. We instead are getting the 76,060 doses. So we're down 5,000 doses plus or minus. And that hurts a little bit because those doses are one and done, as you know. And so people are expecting that. Now, to my knowledge, we're not seeing mass cancellations. This is probably in the out weeks that we were planning on using this particular 5,000 doses, probably next week or the following week. So it'll just make things a little bit tighter. But we are getting a lot of Moderna, a lot of Pfizer, and I think we are going to be fine. They're ramping up like crazy anyway. There's an incredible amount of pressure on Johnson & Johnson to get this straight internally and to the whole world. So we'll get there, but it would have been an extra 5,000 doses, and that same can be said about next week. I don't think they're going to catch up for 3 or 4 weeks. But if you look at the big picture, we started the vaccination program technically on, I think it was December 16th. And here we are before April 16th, and we will be essentially opening wide to everybody just a couple days later. And I mean, I can't believe that we're about to touch our millionth shot, honestly. That shocks me. When we've done 2 million shots, we'll be done, because that's going to exceed the number of people that are willing to get vaccinated in our state. So we're at or beyond the halfway point already, and expect a really robust 6-week plan.
It sounds like we're doing very well with the people who want the vaccine. Let's talk a little bit about those who are a little more vaccine hesitant. What is the state doing to reach out to those? And, you know, it could be for a number of factors. What are you hearing as the biggest reason that people are still on the fence about this? And what's the state doing to make sure that we do reach out to those folks?
Great. Yes, exactly. There are people that are vaccine hesitant. It's totally reasonable. I hope that they will all consider being vaccinated. We do think we'll get to over 75% of our people ultimately in the program. We're reaching out with public service announcements. I'm pretty much on a tour telling people that I was vaccinated and, you know, nothing bad happened. I don't know what to say. I'm feeling very relieved to be immune, as are so many of my colleagues in the healthcare community. We are also, you know, frankly, moving some programs forward. They are not directly connected to the vaccine promotion, but we will soon have our Safe Travel Card program up and running, which will mean that if you've been vaccinated plus 2 weeks, you'll be able to travel inter-island and soon from the mainland without having to do the pre-test, which is a nuisance. I mean, getting the pre-test, which costs $120, and having to time it within 3 days of your travel, or else you get quarantined, is, you know, problematic. It's a challenge. It's kept us safe. The case counts have been low, but being vaccinated is going to be even better. And so it's just an incentive in a way. It's a good thing in my mind. We can talk a little bit more about that, because I have a lot of updates if you're interested on the Safe Travels Card, aka the vaccine passport, which some people call it. But that's a big incentive. I think that will probably mean a lot of extra people will finally decide, I was probably going to get it anyway. Now I'm definitely going to get it if I can travel inter-island without having to be tested. These are the main things, but every time that we go into a community that's had some reluctance, if we do have a rational conversation about vaccines, the vaccine has been safe, the studies have been thorough, then most times we jump up 20 to 25% as far as participation. It takes a lot for some people to get over their hesitancy, because this thing came to us over the course of just, I don't know, about 8 months. And some people feel that COVID is not that severe, but try telling that to any number of families who lost a loved one. 471 individuals did pass away from COVID, including a dear friend of mine who's 51. So it's not just very, very old people. It could be others. All of these things are for their consideration. I personally respect anyone, whether they choose to be vaccinated or not. They have to make that choice for themselves. And the same will be true of their adolescent children. Soon it will be 12 to 16 on the Pfizer shot. But if someone chooses not to, that will be factored in, and we will still get to herd immunity because most people will get it.
Let's talk a little bit about what you had mentioned and that passport. We do have a question that has come in from Stephanie, and she summarized it. Well, I'm sorry, that's not the question. Basically, what the question was asking about, here we go, Governor Ige's recent emergency proclamation does mention the anticipated new quarantine exemption for fully vaccinated travelers, but needs to be approved by the HIEMA director. Can you talk more about that? Do you know when that might be implemented? Is there any updates that you can provide us on what that will look like and how the state will validate those who have this vaccine card?
Yes, I'll give you, this is unusual, I'll give you direct process that we met on this morning and through the weekend. So thank you for that question, Stephanie. The Safe Travels card will look like this. You will upload a picture of your card, your vaccine card that you've received from the CDC. We will also have a drop-down box where you will, it looks like this is our tentative plan. We'll give to the final details in about a week, but the tentative plan is people will type in their lot number and the date that they finished their vaccination. So we'll be able to determine if it's been 2 weeks since, and then we will see the card in person when someone shows up, and that will be our validation. Meanwhile, behind the scenes, the software, whether it's from First Vitals or Clear or Common Pass or other companies that we've been working with, will be doing a lot of verifications about whether or not that was a legitimate vaccine process, that person was legit. If someone defrauds us, there will be a disclaimer there that we tell them you'll be subject to very significant penalties, because everyone should remember that this is not just like faking a test, which you shouldn't do either. By the way, we did arrest somebody for faking a test on Friday. I could share that with you if you'd like. But this is a federal document, and violation of that law, which is falsification of federal documents, like a CDC document, is a felony and carries with it, I believe, up to 5 years in prison. So, look, I don't want us to have to be the pandemic police or the vaccination cops. I just want people to be honest, and I know our people will be honest, but there will be a lot of people traveling from abroad and the mainland who might consider taking advantage. I'll tell you, it'll be a very small number. It's going to be well less than 1 out of 100. And of those people, the positivity rate prevalence is about 1 in 1,200. So you're now talking only 1 out of 120,000 people would fake a card and be positive for COVID. So it will not affect us from a pandemic standpoint or a public health standpoint, but we still don't want people breaking rules. So that's where we are. And I think it's going to be very good. But that kind of validation process should be enough for us. And we're debugging it now. What I think will happen is if we do meet our internal deadlines, we're hopeful that by May 1st, we'll be able to do it for inter-county/inter-island travel. I'm personally asking if we can possibly do it also for trans-Pacific travel, but it may very well be that the governor and the mayors want to first do for inter-island, which is nice for us as residents, and then a month later come on board with trans-Pacific travel. Either way, it's a big win for us, because knowing that people are vaccinated is even better than knowing that they got a test within 3 days of travel. It's even more reliable. And that's what I can share. I mean, we're actually working on this in real time. Our plans are being finalized as we speak. And I'm hopeful that all of the briefings will go to the Gov on this Wednesday so that he can make a determination whether we've given him enough kind of meat on the bone of this plan.
Nunji's mic is muted.
Sorry about that. Do you see any broader application for this kind of a verification? I know that in the United Kingdom, they've been talking about creating some kind of a similar program, but that would allow you into, for instance, athletic events or concerts or what have you. Do you think that the state would ever adopt something like this, beyond travel, any kind of vaccine verification?
I think so. I think it could be very useful for large events, for the marathon, for concerts. I think we want to be fair to people. If they don't want to be vaccinated, we should still let them do a rapid test beforehand and also be cleared. But we could bring large events back. You've got the Ironman that comes every fall, which is a huge event for West Hawaii on Big Island. Of course, the marathon in the winter months, in December usually. I know that the concert folks and the convention center folks would love to have big conventions again. So all of these would be very good events internally. So if we have the ability to show that our 75 or 80% of people were vaccinated, it would be easier for us to take kind of the handcuffs off of our own population and let people have big events that the mayors could then much more easily and in a safe way open up for. Look, we're going to be pretty safe anyway, because by July 4th, we're going to have so much immunity and vaccination done that I'm not going to be too worried. However, wouldn't it be nice to know that if someone was holding a 2,000 person conference for the dentists of America or something, that we knew all those dentists were vaccinated and came in, and that was not a big deal when they went and stayed at a hotel or at the convention center. So I think those are the many ways that we could further empower ourselves. Again, there's been some talk about this impinging or infringing on people's civil rights. I don't want it to be that way at all. Mind you, this is probably going to be a very temporary thing just for the year of 2021. I can't see why, once the world is vaccinated and COVID starts dropping off, why we'll still be doing this. But as long as COVID's going on, or if there are variants internationally, it might be good to know that people were vaccinated. I think it just further empowers people and will keep all those other possibilities for travel available. I don't want to have a two-tier system. There should not be two classes of people, and we should still respect people who don't want to be vaccinated. But for those who do get vaccinated, they are making a decision to be safer, and that makes everything possible.
We have a question here from Travis that's also asking, will kids who cannot get a vaccine still have to test when traveling? Because we know that right now, children aren't, necessarily available to get the vaccine. And so if this vaccine card is a way to bypass that for travel, how do we manage that with our children?
Great question. We're likely to still have children get tested until we have declared herd immunity, is my guess. We don't have a clear mechanism. We're certainly not going to force children to get vaccinated. We're not going to force anyone to get vaccinated. There is a possibility, and I am, beginning to socialize this idea, that if the parents or the guardians of the children have been vaccinated and they travel, that we give an exemption to the children that travel with them, because the probability will be very low that they will be positive. But if they're adolescents and they're in school, they could be positive. So it's probably going to be the case that we still have them just do the safe travels. What I think also would make sense is we begin to adjust the safe travels program to allow for antigen testing at that point, which is more rapid and less expensive. So that way, let's say parents bring their 3 children on vacation with them to Hawaii. Both parents are vaccinated. The 3 children, if they have not been vaccinated, just get the quick swab for the antigen test, which is about $20 each instead of $120. And you can get it rapidly and reliably. That's the direction I'm moving the policy, but I don't think that will be ready for prime time as of May 1st.
You made mention of someone faking a test. Can you tell us a little bit about that?
Yeah. So some people came into Hawaii and they faked their test. They falsified it, and we caught them, and we arrested them and penalized them, or the penalties are pending. But they're being charged with crimes of falsifying vaccination documents. And any kind of, well, you're very well aware that quarantine violations in Hawaii are a misdemeanor. This would be one of them. And that would be a $5,000 fine and up to a year in jail. So they have had charges filed against them. My understanding is that they've left the state. And, needless to say, I'm not going to share their names. I don't want them to be vilified. But they were reckless, and that's not the thing you do. And I was very happy with our team and our Attorney General's staff to catch this. And I want to send a message that people should not break these rules. It's okay if you want to go do the 10-day quarantine. That's fine. Totally fine. But this is a serious time. If you falsify documents, it's not just about you. It's about all the people around you on the plane, where you're traveling, who you could get sick, including our state. An outbreak could occur and it could shut us down again. So these have large consequences when people break rules, and that's why we're being serious about it. And I also want to tell the world that in advance of our Safe Travels card, which is going to be really effective, and we'll be one of the first in the country to do it, I would assume, we also want them to know that if they show up with some crazy card that they just wrote out by hand, we're going to know. And it's not going to fly. They're going to go into quarantine. So we will we'll be mindful. But falsifying documents is a serious thing. I really don't think many people are going to go to that length to have vacations. We have seen very few. I can give you an update. We're about to the 6-month date or 6-month anniversary of safe travels. That's going to be on the 15th of April. And we've now had 2,443,901 travelers, of which 1.8 million of those people were visitors without a bump in cases. Total travel-related cases, total for Oahu, have been 11%. Total travel-related cases to Hawaii, to Maui, was 5% of the cases. And the rates have been very low. So that's how we're keeping the rates low. And this safe travel program has worked, but it worked even better when we have a vaccine standard. And now that people know that we're going to be serious about policing it, it'll be even better still.
Let's spend some time talking about visitors coming to the islands, because there always seems to be a growing debate, especially here in our comment sections, and what we're seeing online is a growing disconnect between local residents and visitors. And many local residents are upset with visitors that are coming back in who aren't abiding by the mask mandate. Many throughout, these heavy tourist destinations in Waikiki and Lahaina, just, photos online of them not wearing masks, not practicing social distancing. And so there is sort of this push and shove between locals and visitors. As a leader of this state, how concerning is that for you when you see this growing division between these two entities, and knowing how important tourism is to our economy?
Well, it's a concern. It's one of the reasons that we put the Safe Travels program in place in the first place, because I knew that if we didn't have any mechanism to at least reassure people that we weren't going to get a horde of people in here with COVID, that there would have been, mass conflict. By having the Safe Travels program, we were able to make the case that most people are safe coming in. Now, as to mask wearing, yes, it's frustrating. I was all over the town, walking around this weekend, going to the beaches, going into Waikiki, and I saw the same thing. A lot of tourists not wearing masks. I also, unfortunately, saw a lot of our dear friends playing volleyball and being at the beach and having beach parties also not wearing masks. So we're all, as human nature would suggest, equally likely to make mistakes. But the tourists, they have to constantly be reminded. A few violations here or there sometimes helps. A lot of the times, though, they are not mingling with local residents. And so it's not a terrible problem. It just is really just not appropriate. We will have to remind people constantly, and people will still even let their guard down, because once we have the vaccination passport, aka the Safe Travels card, I think that people's assumption is, okay, well, look, I proved I'm immune. Why do I even have to wear a mask? That's already the dialogue across the nation. And the reason is that even though you're vaccinated, you could carry some small amount of virus. The sterilization immunity is real. It's decreasing our viral loads if we've been vaccinated, even to carry the virus, but it doesn't mean you have none. And so we have to be safe. We're going to keep fighting this thing until we reach herd immunity. And then I think it will be very reasonable to kind of calm down and not be quite as obsessed with mask wearing and other things outdoors. There's still going to be COVID around all the way through the year, just less.
There's a question here from Reed, which sort of speaks to a larger, how we gauge what's safe and what's not. Please explain the logic or science behind prohibiting parents from watching youth sports. We allow indoor dining, outdoor weddings, open beaches, but no spectators on the field. What's the difference? I know that this is a city determination, not necessarily one from the state, but as we re-engage with our communities, as we start to be vaccinated, how do we decide what's safe and what's not, given that, as Reed points out, this does feel rather arbitrary, that you could go to a 100-person wedding on Oahu or Maui, but you can't watch your kid play soccer.
Yes, I think that policy is bad. That's all I can tell you. I'm in Reed's camp on this one. I think that if parents, friends want to go to a sporting event, if they mask up, it's A-okay. If they're outdoors, it's no risk. We got to get over ourselves. That's obvious to me. And so these are some of the these are the remnants of a lot of other larger policies that are they're just being gotten to now. So I will not be surprised at all if the mayors lift that prohibition. I think that youth sports, in many people's minds, was a reach to start sooner rather than the schools opening. And so I guess there was just a hesitancy to open up wide and have the activities. Remember, some youth sports do attract a couple thousand people. Those are big gatherings. I was always on sports teams where no one would come to watch the sport, tennis and soccer back on the mainland. So we never had any big numbers of spectators until the state championships. But the rest of everybody, when they go to a football game, there could be a lot of people. I would say we're just being a little extra cautious. But come summertime, when we're fully immune, it will be egregious to not allow us to see our kids in sports. So let's get there soon. But we should allow parents to be there as long as they wear masks.
As we wind things up, I do want to switch gears quickly, if I can, to bring up homelessness, because we know that this is something that you were working on prior to the pandemic getting started. And we know that this past weekend you spent some time out in Kalailoa helping with the Kauhale village that's happening out there. And on Friday, we actually on this program talked to Anton Kreki with the Housing and Homeless Division with the City and County of Honolulu. Their philosophy is sort of switching and moving things aside in a different approach to tackle homelessness, with not making the first call that people make to HPD, but rather a support team. What is your thoughts on this, and how do you think the state will align with this? Because it seems that there may be some differences there, but talk about that partnership and how important that will be to make sure that the state and the city are on the same page here.
Yes, so I appreciate you mentioning that, and thank you for being there with your team and family and friends at the Kauhale and Kalailoa. 36 units, that's going to change the trajectory of homelessness for that region and for the people who are chronically homeless. Tiny houses, the price point was under $18,000 per little unit. Unbelievable. I spoke with Anton and the mayor. This is the plan that I'm going to work with them on. They will choose which pieces work best, but it's basically it's a 12-point plan that looks at all of chronic homelessness. It will include what they've espoused as their central principle, which is helping people in a social service way, in a compassionate way, without having to displace people. In addition to that, we have institutes like the H4 that have started for medical respite. We'll support obviously, we're going to support all of the shelters. They, I'm sure, will continue the policies of housing first. But by doing small villages, by opening up our minds instead of prosecuting people and being firm, I'm sure the mayor will be firm, if not sometimes forceful, to get people to go into safe places like those tiny houses. It will work. And actually having tiny housing villages peppered across the state will mean that it won't just be in one person's backyard. It will be spread out, and it will actually be effective. When we do projects like this, we've seen that people's drug and alcohol consumption drops 60% in the first 2 months, which is really good for this population who struggle. Also, you can see that positive benefits on all of society when you have people moved away from some of the urban core where it's very disruptive and can be a lot of drug use and so on and violence, to a place where they have a sense of self, a positive vibe on life. I'm sounding a little preachy here, but I'm just saying we're giving tiny houses out and giving people hope. They may even make a living and work there. And all of a sudden, when you view it through that lens and you decrease their healthcare costs, which more than pays for these projects, it's really just unbelievable. So fresh blood in the mayor's office, which is always something good to see. And I'm so optimistic about that. I tell you, the next year and a half, I certainly am excited to work with this mayor. And then if I'm asked to serve beyond this, I'm going to be pounding this problem for 4 years, because I think this is one of our biggest crises after looking at the COVID crisis.
I want to get to, I know we only have a few minutes, or actually we have like 2 minutes, but I just want to ask you this one from Kimberly. Says Maui is implementing a second test because of variants, too many flying in, spreading. That's the perception. It doesn't sound like that's actually the case, but I'd like to get your thoughts. Why isn't this statewide to stop it flying in? What do you think of Maui doing that?
I support them when they want to do anything that is extra protective, but this one is, I think, more than is necessary. It has not been significant. Like I said earlier, only 5% of the total number of cases on Maui have been travel related. They only had 15 cases on Maui, just so you know, today, and they only had 11 yesterday. I mean, it's very low case counts. Their hospital numbers are dropping. They're at 13 people in the hospital as of this moment, which is, again, small number. That perception is not correct. And the second test, when occasionally done, is fine. But when we did the second test on Big Island, which they did for several months, they found a tiny number of cases overall. So better to use that money, I think, to test people throughout the community, do the extra testing where there are clusters. It's the clusters which are 95% of the cases on Maui. Community spread is 95%. Travel related was overall 5%. Also, the variants, yes, they can be scary, but putting extra energy and resources out that way when we should be spending that money on vaccinations and making sure everyone gets vaccinated as soon as possible probably a better way to go. But we're working with the mayor. I have an incredible amount of respect for Mayor Victorino and all 4 of the mayors. I mean, it is so much work to get this done that it's hard to second guess them, because each of these things matters. But most important right now is continuing to wear masks and socially distance if you can. Get vaccinated when your turn comes up, which is now, basically. It'll be now for everybody on the 19th of April. And just be relieved that we came through this with about 90% fewer fatalities than we had expected going into this crisis. We were expecting 4,479 deaths right out of the gate if we didn't take action. And the sacrifices that you and everyone made has been, it's been heartwarming to see people come together, but we're not quite done yet. These next 6 weeks, we will finish vaccinating everyone that wants it right off the bat. The last tail end will be June, July, and then we'll start feeling normal. So I'm just so appreciative of people, but don't let your guard down completely just now, because I don't want to come back again on 2 weeks and say, oh man, our case counts are up again, and the mayors are thinking about taking a step backwards. Let's move forward together.
All right, Lieutenant Governor Josh Green joining us this morning. Thanks so much for that update and for always taking our viewers' questions and being a part of this conversation. Mahalo.
Thanks. You bet. Mahalo.
Thank you. Well, we covered a lot of ground there, as always, Ryan, and I know we got to as many questions as we could. Really, a lot of the focus on that Safe Travels program, a lot of the questions that you folks had. So it sounds like the plan is, if everything goes as scheduled, May 1st for Inter-Island with vaccine verification, 2 weeks post second shot, or 2 weeks post Johnson & Johnson if you get the single shot, and the target date of June 1st, though that could be a little more fluid.
Yeah, a lot of it will
for Trans-Pacific, sorry.
Yes, and a lot of it also will be determined, of course, by the governor, Lieutenant Governor, saying that he is working with the team is working on putting all of this together to submit to the governor to seek his approval. We do, of course, know that was included in the last emergency proclamation. So there is the shell, if you will, that is there. It's really them just trying to fine-tune some of the details that need to go into this, including the questions that have also come up about testing for children, because we do know that children cannot or do not qualify right now for the vaccine. Lieutenant Governor saying at this point that children will likely still have to go through the testing process as we currently see it. Also getting an update on the vaccines, noting that Hawaii is close to getting and reaching that 1 million milestone coming up here in just a few days. So a significant milestone here for the state of Hawaii as we continue to be one of the top states in the country through this vaccine rollout.
Yeah, fantastic to hear those numbers. And, a week from today, the 19th, I believe, is that a week from today? Yes, it is. Yes. Which means that a week from today, anyone who is an adult will be eligible in the state of Hawaii. He did encourage folks to check multiple websites because there could be a little bit of, a traffic jam, if you will, for folks signing up for the first time. But that he said those pharmacies, Safeway, CVS, Walgreens would be also great places to check. Because they have a lot of vaccine coming in as well. So, all good things there. We will be talking to the governor a week from today on Monday to get his thoughts on these same programs and hear what he thinks about safe travels. But I know there are a lot of folks who are writing in the comments that they want to see that open up. That hiccup, though, with the kids could be a little bit difficult when it comes to summer family travel.
Yeah, we'll just have to wait to see how that all gets rolled out. And again, looking forward to that conversation with the governor. Looking forward for the rest of the week. We also have another popular guest, if you will, that will be joining us later in the week on Friday. The director of the Department of Labor and Industrial Relations, Ann Pereira Eustaquio, will be joining us to take your unemployment questions. We know that continues to be something that many people are struggling through and have a lot of questions on. There was also a report this morning of more fraud that continues to plague the department as they try to find ways to get payments out, but also deal with that tackling issue of fraud. Fraud alert going out this morning of another case that they are dealing with as well. So getting an update from her. Again, that show is on Friday.
But on Wednesday, we're going to be shifting gears and talking about the possibility of marijuana legalization. That is something that the Ledge is looking at right now. We're going to be talking to Chris Lee from the Senate to talk about why he supports this measure and where this actually is, what this could look like in Hawaii. And then we'll be talking to some folks on the other side from the Coalition for Drug-Free Hawaii on why they think that now is not the time to legalize marijuana in the state. So we know a lot of you will have opinions on that. So please do join us right back here Wednesday at 10:30.
We'll see you then. Aloha.